surgical technique for the treatment of articular cartilage defect, the RevoCart system. As we know, the cartilage injury remains one of the most challenging problems in orthopedic because they are poor healing potential. Today, I will present how RevoCart offers a single-stage autologous cartilage repair that combines biological advantage with surgical efficiency. I will also share my surgical experience as a clinical outcomes. This is my disclosure. As we know, osteal complications in the knee are highly prevalent, more than we saw, especially in athletes, ACL injury patients, and older adults. If left untreated, these lesions have poor healing potential and often lead to early OA, even advanced OA. Our challenge is to restore a durable hiding cartilage, yet most of the current treatment still result in fibrocartilage. First, I'd like to share a case I have been working on. This is a 51-year-old female, an active tennis rover, presenting with persistent knee pain, swelling, and catching sensation. Her X-ray showed KL grade 2 change, and the arthroscopic, you can see reveal ICR as maybe grade 3B or higher in the femur circus and the medial and the lateral femur condyle. We tried many treatments, but they didn't work. You can see the lesion progressed to maybe 3C or higher. This case highlights a treatment gap for the middle-aged active patient, too young for arthroplasty and too advanced for the simple biologic. So, what is the best strategy moving forward? My choice is RevoCart, simple and effective. RevoCart is designed as a single-stage procedure and typically completed in under an hour. The steps are straightforward. First, we will harvest a small amount healthy cartilage from a safe, non-bleeding zone, and this tissue is mechanically minced and digested with cartilaginase to release the control slide. And then the prepared cartilage are loaded into a biphasic scaffold composed of PLCA for the control phase and beta TCP for the osseous phase. And finally, this prepared scaffold are press-fitted into the defect for the stable fixation. I think the press-fit is enough. You can see together these three pillars of cartilage tissue engineering create a stable and biologically active repair environment. I think this is the randomized control trial. We call that Biphasic. Biphasic study is the first randomized control trial providing the high-level evidence for the RevoCart effectiveness. It's a 2-year. RevoCart not only improved the function but also demonstrated superior cartilage regeneration on MR and histology. Our biopsy confirmed the repair tissue is hiding cartilage. So you can see this is 5-year result of RevoCart. The cruise spots almost stayed in maybe 100 points. And the microfacial group dropped to maybe 70s. And the RevoCart has high rate return to sports rate, maybe around 90%, and the microfacial group only 8% patient can return to high level of sports. So the durability is very clear. But these results can truly stand the test of time. I can show you the 10 years result. This is 10 years result of RevoCart, and the functional outcomes remain satisfactory. So here I'd like to share two unique 10 years follow-up cases. The first one, here you can see the pre-op MRI show the cartilage defect, and the middle is the intra-OP finding and the RevoCart implantation. And on the right, after 1 year, the second look show the good cartilage regeneration. There is no gap between the defect and the healthy cartilage. And you can also see on MRI, it's good cartilage feel as 1 year, 2 years, 5 years, and even after 10 years, the repair site is stable and well maintained. So you can see the MRI. The second case, the patient has a quite big defect, I think more than 2 centimeters square. And I show you, the RevoCart can really last as well. 1 year fail, 2 years integrate, 5 years stable, and 10 years durable. Ten years after the surgery, the cartilage is still there, and the scaffold is gone, and the patient is back on road, riding strong. So this case reminds us that beyond the imaging, our primary goal is to restore function and quality of life, and the RevoCart can deliver both. Finally, in 2020, RevoCart was officially approved by TFCA, proved our innovation is not only effective but also validated, and we are ready to serve patients. In Taiwan, the indication for the RevoCart is osteochondral defect, like trauma, osteochondrofacial, or osteochondral deficient, and dissection, or SOM, insufficient facial, even early OA, can do the RevoCart. But it is very important to first correct this issue like malalignment, or patella instability, ligament deficiency, or meniscus problem to achieve good outcomes. In Taiwan, RevoCart has already been used in over 900 real clinical cases, and the number is still steadily growing. My personal experience is already over 150 cases, and the result is persistent with reliable, effective, and reproducible in real-world practice. Here is two examples. On the left is an early OA case with osteochondral defect of the trachea and the medial femur condyle. And on the right, an acute trauma with an ACL injury combined with osteochondral fracture of the lateral femur condyle. Both underwent the RevoCart implantation, and the follow-up MRI show good cartilage restoration and integration. This is patella case. This patella case demonstrates that even in technical demanding location, and the RevoCart can provide reliable cartilage restoration. So these cases highlight how RevoCart can be applied in different clinical scenarios with consistent cartilage regeneration. So this is a very powerful case. A 33-year old female, a professional volleyball player, but he suffered from multiple osteochondral defect in both knees. These challenging cases demonstrate that RevoCart in high demand athlete with multiple lesions, RevoCart can provide a stable and reproducible cartilage repair. I can show you a result. This case demonstrates not only restorative healing, but also successful return to high-level sports, which is the ultimate goal for our patients. So far, you have been see the open procedure, but this technique can be done completely arthroscopically. So let me show you some case of inside arthroscopic technique. Here we see a 57-year-old female with sunk of both knee. Her MRI showed typical subchondral change with bone marrow edema and articular surface collapse risk. So first, we make two standard arthroscopy photo incision and then size the defect for the exact scaffold fit. And the cartilage was harvested, minced, prepared, and loaded into scaffold, and finally landed into the defect. So we harvest the cartilage through the arthroscopy and drilling to prepare the defect and the scaffold using a special deliver to load it into the defect. You can see MRI confirm the cartilage healing of both knees, and the patient is back to normal daily life. This is the true success of RevoCart. The second case is a challenging case, an osteochondral dissecant case. As we know, osteochondral dissecants is remained a challenging problem in orthopedic. We need advanced strategy to treat that beyond the microfracture. So that shows how RevoCart was applied in this case. So with RevoCart, the steps are simple: size, harvest, prepare, drill, and land. So the procedure all done through two small incisions. The MRI shows excellent defect filling and integration. Functionally, the patient is pain-free and back to normal activity. He's very happy. So recovery after cartilage repair is gradual. Our rehab program is partial weight bearing in 2 weeks, low impact at 3 months, and moderator at 6 months, and high intensity sports maybe at 9 to 12 months. Depends on the patient factor and the compliance. But a successful outcome isn't just about what happened in the operating room. It's also about carefully structured rehab program. So this is our physical activity recommendation. I think RevoCart is a reliable, stable, single-stage articular repair procedure that can deliver high-quality results. But success depends on patient selection, precise technique, and committed rehab program. So I show some case. RevoCart is not only applied in the knee joint, but also can apply in the shoulder, like heel sock, and the elbow osteonecrosis case, and even in the ankle joint. So, thank you very much.